The following segment is sponsored by Oakview Medical Associates.
As you admire all the beautiful blooms of spring, your allergies may be in bloom as well. If you're dealing with symptoms like sneezing, a runny nose, stuffy nose, watery, itchy eyes, ear congestion, or postnasal drainage, you might be suffering from seasonal allergies, and Dr. Anita Bijoor is here from Oakview Medical Associates to talk about it. Hi, Dr. Anita.
Hi, Margaret.
First, we should touch on the difference between allergies and COVID-19. What do you want people to know?
Of course, with the allergy season, we might assume that all our sniffles are allergies. It's really important to talk to your physician and get tested for COVID-19 because we are in a pandemic. So that needs to be excluded first. But with allergies, usually people have a history of allergies, history of sensitivity to certain pollen, dust, mold, whatever it may be. There's also a more predisposition for itchiness, runny and watery eyes and nose and ears and throats. All the passages get really itchy. Whereas in COVID-19, there's more of fever, shortness of breath, productive or a cough, sometimes loss of smell. So those are the subtle differences between the two.
Gotcha. So we rule that out with the doctor's appointment for sure. Get the test. This time of year, pollen is everywhere, and your first tip has to do with good housekeeping. You might want to wash your bedding in hot water at least once a week, you say, right?
Absolutely. So hot water will, essentially rid your linens and the pillow covers and all the allergens that are out there, and that will really minimize your symptoms. You'll start to notice an improvement in your allergies.
And you talk about covering your bedding with pillows that are allergen-proof covers as well. What are those and how do they work?
So those are really big favorites with the allergists. Basically, they are, allergy-proof or dust-proof covers that go over your mattresses or pillows, and they really provide a good barrier against letting those allergens settle in within your linen, and that can be a big difference, night and day difference, because we sleep, through the night, and that exposure can really make a big difference.
Well, people love letting the fresh air in sometimes this time of year, but you say you want to keep those windows closed.
Yeah, well, I've noticed even in my family, like we'll just spend some time outdoors and come back with extremely itchy nose, throat, eyes are all watery. So just minimizing, not keeping the windows open. Firstly, you'll keep your house really clean because the dust and the pollen doesn't get in as easy, but it also does reduce your symptoms.
And what about using a dehumidifier to reduce excess moisture? How does that help, and what kind of difference can it make?
So certain people have, allergies. If you have allergies towards certain types of mold really thrives in moisture. So dehumidifying really gets rid of that moist environment that is needed for some of these allergens to thrive in. So you're essentially eliminating that environment, and they don't tend to cluster around.
Well, finally, you say allergy sufferers really should just limit their time outdoors. It's as simple as that. What's your recommendation there?
It's not really that simple. I know 1 year of the pandemic, we're all wanting to get out and enjoy the outdoors. But I think just, trying to limit, there are certain times of the day that is very high in terms of pollination, and the pollen counts are higher. That's, it's something to just be mindful. Late evenings, when it's cooled down a bit, might be a little better to take a walk and so forth. So.
Good idea. Keep an eye on those pollen levels. Anybody struggling with allergies, like we said at the top, should talk to a doctor. And at Oakview Medical Associates, you can diagnose and treat their symptoms. You're located at 11 Five Forks Plaza Court in Simpsonville. The number is 627-0444 on screen now. Dr. Anita Bijoor from Oakview Medical Associates, thanks for being here.
Thank you.